Okay, everybody can see? All right. Okay, thank you for waiting. So, doctor already introduced me, so I just skip this slide. So please call me Jack. Okay, today I will give you the presentation about the dementia prevention through Japanese old media, which is Kamishibai. Do you know Kamishibai? Kamishibai is just like a paper play. It's a form of Japanese story theater and storytelling that was very popular in the past in Japan. So, dementia, digital Kamishibai, it is originated from Kirameki Kaigo Juku. Okay, let's start. Dementia prevention. How can we prevent dementia? Okay, let me start with this. What is the number of people living with dementia worldwide? Look at this slide. Okay, the world population was about 7.8 billion in 2020. Out of that, the 50 million people had dementia. Okay, and then 2030, 82 million people will have dementia, and then after 20 years, 2050, world population were at 9.7 billion, and 152 million people will have dementia. So as you can see, the number of dementia patients has increased dramatically every year, but I think you don't take it seriously because the number is very huge. How about this way? One person is diagnosed having dementia in every 3 seconds. Like one new patient, dementia patient appear, and one new dementia patient appear. What do you think? It's so many, right? Okay, then let's look at the situation in Japan. What is the number of people with dementia living in Japan? Okay. Population in Japan about 125 million, and 4.62 million people have dementia, and another 4 million people are diagnosed as mild cognitive impairment, MCI. So MCI is the stage between the expected cognitive decline of normal aging and the more serious decline of dementia. Okay, in short, you become forgetfulness with age, but you can lead a daily life without problem. You are diagnosed as MCI. But if you have a problem in daily life, you will be diagnosed as dementia. Okay, for people diagnosed as MCI, 5 to 10 people with MCI will transfer to stage of dementia every year. But it doesn't mean that everybody would have dementia. Okay, look at this. 40% of people would alleviate the condition and remain the same stage of cognitive decline of just normal aging. So, by the way, how many kind of dementia are there? The old lady asked the geriatric doctor. And the doctor answered, there are about 70 to 80 kind of dementia right now. But these 4 dementia, type of dementia are very popular, like vascular dementia, Alzheimer's dementia, dementia with Lewy body, and frontotemporal dementia. So actually these 4 type of dementia account for 90% of dementia. Another 70 kind of dementia are in remaining 10%. Okay. Okay, then question. Everybody, question. Which dementia below can be prevented? Vascular dementia, Alzheimer's dementia, dementia with Lewy body, or frontotemporal dementia? What do you think? Okay, let me answer. So vascular dementia can be prevented. Okay, this is a dementia caused by an after effect of cerebral infarction or cerebral hemorrhage. About 20% of people with cerebral stroke will have vascular dementia as an after effect. That is why you can prevent this dementia by reducing the cause of cerebral stroke. That is lifestyle-related disease. Okay, so what is a lifestyle-related disease? High blood pressure, diabetes, or hyperlipidemia. Okay, by preventing these life-related disease, you can reduce the possibility to develop the cerebral stroke, which means that you can prevent vascular dementia. In short, preventing lifestyle-related disease is dementia prevention. Okay, let's try self-diagnosis for cerebral stroke. Okay, we can check if a blood vessel in the brain get clogged or not by sticking hand out. Sticking hand out. Okay, everybody? First, put your hand forward with the palm facing up. Okay, everybody? I don't know everybody do or not, but it's okay. Let's move on. Okay, then close your eyes. Close your eyes for 10 seconds. Close your eyes. Please close your eyes. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, open your eyes and check your hand. Check your hand. It's gonna be okay if your hand remained at the same level, but because the symptom of cerebral infarction is one side of paralysis, so that if the blood vessel in the brain get clogged, one side of your hand likely to falling down, like this way. If your hand remains the same level, it's okay. You don't have a cerebral infarction. Okay. Question 2. Are there any type of dementia that can be cured completely by medicine or surgery? Yes or no? Yes or no? What do you think? Okay.
Maru.
Okay, thank you. Thank you. From medical viewpoint, the answer is yes. Actually, it is a very few, but there are some dementia can be cured. For example, dementia caused by normal pressure hydrocephalus. Hydrocephalus is a condition that occurs when fluid build up in the skull and cause the brain to swell. The brain is oppressed by the water and will cause memory disorder. But if the water drains from the brain well by surgery, it can be cured. Hydrocephalus has a 3 features like a memory disorder, joint disorder, or incontinence of urine. Okay, if these 3 symptoms appear at the same time, it might be hydrocephalus dementia. It is possible to be cured. Okay, next one is dementia caused by chronic subdural hematoma. Okay, it is caused by small bleeding in the brain when you fall. Okay, usually the symptom doesn't appear soon because the bleeding is very small. But day by day, bleeding becomes bigger. 1 month or several months later, after you falling, memory disorder will appear. But if the tremors are removed by surgery, the dementia can be cured. Okay, last one is dementia caused by cerebral tumor. This dementia is also cured if the cerebral tumor is removed by surgery. So, as you can see, actually, aside from these three dementia, some more dementia can be cured. Of course, it is very few, but they are curable. Okay, so that the early diagnosis and the early treatment are very important. Although we can't cure most of the dementia, but it is possible to slow down the progress with early treatment. If you feel something wrong, it is better to see doctor. But I think maybe you want to know when you should see doctor. Which symptom you find you should ask doctor, maybe you don't know. So here are the symptoms of Alzheimer's dementia in the early stage. Okay, for example, you can't remember what you said in the morning later in the day. Or you put on the clothes not suitable for the weather or occasion. Or in shopping, you bought what you already have in the refrigerator. Or many small coins left in your wallet. Okay, these symptoms might be apparent in the early stage of Alzheimer's dementia. Of course, nobody wants to suffer from Alzheimer's dementia, right? Are there any way to prevent Alzheimer's dementia? Okay, as you know, the dementia is a problem in the brain as we get older. For human body, there are some part of the body preventing from aging and some part not preventing from aging. Okay, question. Can eyes be prevented from aging? Yes or no? Yeah. Good.
Yeah.
Thank you. Thank you very much. Yes, you're right. Eyes cannot be prevented from aging. No matter how careful you treat, your eyes sooner or later, your eyes dim with age. Okay, how about the bones? Can bone be prevented from aging?
No.
No.
Yeah.
No. Answer is yes. Okay. Bone can be prevented from aging because some people will have osteoporosis, but some people won't have. We can prevent it. Okay, next one is this. The how about ovary? Ovary
Yeah.
cannot. Yes or
Yes.
no? Yes.
Yes. No.
Thank you. No.
Yes.
Yes. Okay. Answer is no. Ovary cannot be prevented from aging. Every woman reaches a certain age, menopause will occur. All right. How about this? Legs. Legs. Can legs be prevented from aging?
No.
No. Everybody? All right.
Yeah.
Thank you. Yeah. Thank you. All right. Answer is this. Yes. Legs can be prevented from aging. It is common saying that if you don't work, you can no longer work. Okay, last one is this. Brain. Can brain be prevented from aging?
Yes.
Yes. Yes. Or no?
Yes, sir.
Good.
Yes. No. No.
Yes.
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 Okay. Fortunately, brain can be prevented. So, next, let's think about how do we prevent brain from aging? Okay. Geriatric doctor said, dementia is caused by the decline of the brain function. We can prevent dementia
Dari
by
tadi dengerin kok
dementia by activating the brain. But how can we keep our brain active? All right, let me explain how does our brain age. Okay. So when we are born, there are 14 billion cells in our brain. 14 billion. But when we are over 20 years old, 100,000 cells dies a day. Okay. Then forgetfulness will begin year by year, which was never happened when you are young. But if you activate your brain, the network of nerve cells strengthen like this, strengthen. Okay, let's consider networks of nerve as a load. Okay, if the one lane road, which is always traffic jam, okay, is expanded, become two lane road, the car can move smoothly, right? Same as this, activating brain means that information in our brain can move smoothly by strengthening the networks, like making 2-lane or 3-lane for the information move smoothly. Okay, in addition, according to the recent research, we have the dormant state of nerve cell in our brain like this, dormant cell, sleeping cell, okay? But by using our brain well, we can activate the dormant state of nerve cell like this. You can move more smoothly. That is activating the brain. The next, what you want to know is how do we activate our brain, right? As you know, the Alzheimer's dementia, the main symptom is memory disorder, right? Memory disorder. And then here is a mechanism of memory. Okay, first, memorize. Secondly, retain what you memorize. Thirdly, to recall what you memorize when it is needed. This is the 3-step, okay? Among these 3 steps, what is the most effective training for dementia prevention? It's to recall, okay? Okay, let me explain one of the memory training. Okay, the first memory training is this, the cooking class. Some Japanese local government hold the cooking class for dementia prevention. They invite the elderly in the local community for cooking class. Okay. Okay, today's menu is the spaghetti. Okay, let's cook spaghetti, but without using stove. Why we don't use stove? Because challenging something new is more effective to activate the brain. I think everybody can cook spaghetti with using stove, right? So that's why the without using stove, I think that is something new, the challenging. Okay, procedure is this: the putting spaghetti and water in the same container and warm up in the microwave oven. Now, after a little while, spaghetti is completed. Then everybody ate spaghetti and then enjoyed. That's all. But if we finish this way, that is just ordinary cooking class. We should do the cooking class for dementia prevention so that we can't finish it. Okay? We should do something after eating. So question, everybody, what should we do after eating spaghetti? Everybody? So one student say, after eating spaghetti, we clean the kitchen. Yes, that is also okay. But answer is this: recalling cooking procedure and memorizing it. Memorizing the procedure, like for example, how much gram of spaghetti were used, or how much water, or how long we warm up in the microwave, what kind of ingredient inside the spaghetti. By recalling the cooking procedure, we are using our brain a lot. Okay, memory training number 2. Okay, let's play the rock, paper, scissors game by using your hand. By the way, do you know game of rock, paper, scissors? It is called
Jankenpoi.
So, jankenpoi desu. It is called janken in Japan. Okay. Let me explain the rule quickly. Rock rock beat scissors because rock crushed the scissors, right? Okay. Then scissors beat paper because scissors can cut paper. And then paper beat rock because paper cover the rock and then throw away. Okay. This is the rule. Okay. Okay. So by using the hand, you can activate your brain effectively. So adequate stimulation with your hand can develop the communication of nerves in the brain. Okay. Let's play rock, paper, scissors game with your both hand for 3 times. Okay. So whichever sign of hand you can use, but should be same sign. Should be same sign like rock and rock, or paper and paper, or scissors and scissors. Okay, should be same sign. But do not use same sign 2 times in a row, like a rock and rock, or scissors and scissors, paper and paper. Okay, don't repeat. Okay, are you ready? So let's try it together following this rhythm. Okay, じゃんけんぽんね。はい、いきます。じゃんけんぽん。じゃんけんぽん。じゃんけんぽん。Okay? Make it? Good.
はい。
はい、ありがとう。So next is more challenging. In the 3 times, your right hand should always beat your left hand. Okay? Are you ready? So should be like this, or like this, or like this. Your right hand always beat left hand. Are you ready? Are you ready? Okay.
はい。
じゃんけんぽん。じゃんけんぽん。あ、間違えた。ミステイク背景。じゃんけんぽん。で、
はい。
Alright, thank you. What we did now is to act differently at the same time. Doing different actions spontaneously can activate brain more effectively. So actually, it is easy to show the same sign with both hands, right? It's easy. If it is easy, it would be less effective to activate brain, so that a little bit difficult task or challenging task can help more to activate your brain. Okay. All right, next, let me introduce the sister Maria. So she is a very important person when it comes to dementia prevention. She was featured in the book titled Aging with Grace. So Sister Maria was very active. When she waked up in the morning, she looked over the newspaper, and after that, singing a song and studying and enjoying conversation with visitors in church. She always said that I retire only when I sleep, which means that she would never retire. As if to prove what she said, she lived a satisfying and active and meaningful life even after she was over 100 years old. In addition, she got the high score with the intelligence test and was diagnosed not having dementia. However, after she passed away, it was discovered that the weight of her brain was only 870 grams. Generally, the weight of adult human brain is 1.2 kilograms, so that her brain was quite smaller than ordinary brain. In examining her brain further, it was also discovered that there were many transformed brain cells, which was the feature of Alzheimer's dementia. In short, obviously, she had Alzheimer's dementia. But surprisingly, people around Sister Maria could not recognize or could not realize that she had dementia. They didn't realize. That is why she was said to be a special person who didn't suffer from dementia, even if her brain diminished. But not only Sister Maria, but also there are people like Sister Maria in Japan. Do you know them? The Japanese famous twin sister, Miss King and Miss Gin. They become very famous even after they were over 100 years. Please take a look at their TV commercial.
銀は100歳、100歳。銀も100歳、100歳。ダンス銀を生むなら100番、100番。嬉しいような、悲しいような。
Very cute. Very cute. So, we can say that they are Japanese Sister Maria because actually the Miss King and the Miss Gin were very reliable and at that time still had their own judgment clearly. When they were interviewed, they could answer clearly and even told a joke to make people laugh. But after they passed away, it turned out that they had Alzheimer's dementia. Do you believe they had a dementia? Okay, according to one of their family, Miss Gin repeated same story during a day, but after they become famous and appeared on the TV show, become active, she didn't repeat so often. You know, as I told you at the beginning, 40% of people who have MCI, mild cognitive impairment, can alleviate the condition. Probably these twin older sister could, alleviate their condition of the brain by being active with TV show. Okay. Question: how many elderly wouldn't have dementia even if their brain diminish or shrink, like Sister Maria or Miss King or Miss Gin? To pursue the answer, Japanese, the scientists researched it. First of all, 443 patients in the hospital took the picture of their brain by CT, computed tomography. Then 97 patients were diagnosed as Alzheimer's dementia. Okay, 97. Secondly, these 97 patients took the intelligence test for dementia. Of course, mostly they got a lower score and showed some typical symptoms of dementia, but some of them, surprisingly, some of them got the perfect score and doesn't have dementia. Okay, here is a question. How many patients got the perfect score and doesn't have dementia out of 97 patients? What do you think? Okay. Answer is this. Surprisingly, 32 patients got the perfect score and doesn't have dementia. Then, researchers continued to investigate why they didn't have dementia. Finally, they found 32 patients have something in common. Okay, do you know what? Commonality is this, their common factor is all of them are active about their hobbies or intellectual activity continuously and do their hobby and activity with their family or friends. In short, they attend the place where people gather for activities, such as daycare center or local cultural school or local community or church. Okay, that is a key factor to prevent dementia. So recently, many medical specialists say dementia had already started in the brain even 20 years ago, which means that abnormal protein which is caused Alzheimer's dementia were apparent 20 years before the symptom come out. The dementia is developed by increasing the abnormal protein for 20 years. It takes 20 years, okay? For example, this old man started to suffer from dementia when he was 80 years old. But his brain already started to be affected when he was 60 years old, 20 years ago. Okay? Then, when he turned 80 years old, the symptom of dementia appeared like a memory disorder. But of course, he didn't die right after having dementia, right? He lived his life until 85 years old. So his lifespan is 85 years old. Okay, in this case, in the funeral, his family say he was fine until 80 years old, but since then, he had dementia until age of 85. It means that he had dementia for 5 years, from 80 to 85 years old. Okay, maybe their family, his family, took care of him. But according to the recent theory of preventive dementia care, it is possible to delay the onset of dementia. It is depending on how does he spend the time before the onset of dementia. Like this, for example, supposing that he uses his brain actively to delay the date of onset of dementia from 20 years to 30 years. Okay? And then, after 30 years, 90 years old, when he turned 90 years old, he started to have dementia. But remember, his lifespan is 85 years old. Okay? So that he died before he had suffered from dementia. Maybe he will have dementia in the heaven. Okay, in this case, his family say he passed away without having dementia, maybe happily. Okay, so it is clear of the difference between these two cases. No matter how long you can delay the onset of dementia, sooner or later you have a dementia. But if you can delay the onset of dementia longer than your lifespan, you would never suffer from dementia. So, in fact, what is dementia prevention is? Not preventing dementia, but trying to delay the onset of dementia longer than your lifespan, like Sister Maria and the Japanese old twin sister, Miss Kim or Miss Gin. Okay. So here are the 5 tips of activating the brain. Number 1, talking with others. Number 2, getting some exercise. Number 3, stimulating the brain. And number 4, getting curiosity. Okay. Then here is a question. What is the last one? What is the last tips? Everybody? Okay. Laughing. So, laughing. You laugh when you enjoy. But recently it is said that your laugh make you enjoy. When you make a smile by raising corner of the mouth, the brain misunderstood that you are enjoying, so that the brain secretes the hormone to develop immunity. It makes you healthier, become healthier. Okay, this is the last part. Okay, I want to introduce one article on the newspaper. It said that they conducted a follow-up survey of 3,000 people who potentially have dementia, mild cognitive impairment. Okay, they divided 3,000 people into 2 groups and investigating for 3 years. The first group was composed of people who joined the local community or daycare center or church regularly. The second group was composed of people who didn't join and mostly stayed home. Okay. The survey after 3 years showed that most people in the first group don't develop dementia. On the other hand, 30% of second group had dementia. Okay, to tell the truth, the local community or daycare center or church, the place where many people gather for activities can cover that 5 tips of activating the brain. Like, for example, when you join the church or local community, you would talk with others, right? And the activity are prepared so that you get some exercise. So these activities can stimulate your brain and make you get the interest in the various things that you don't usually do. In addition, you spend a good time with your friend so that you smile or you laugh. Okay, in reality, the best way to prevent dementia is attending such enjoyable place. Okay, where is your enjoyable place? Daycare center in your neighborhood or local community or church or coffee shop or restaurant with your friend? Any place is okay as long as you can attend and enjoy with your friend. But if your friend doesn't have such place, please invite them to join your community because you can enjoy more and you can laugh more with your friend, right? This is the best way to prevent dementia and the best way to contribute to the aging society. Okay, let's enjoy your life. Thank you very much.